Thank you very much. Our next speaker is Heather Turbine-Pollard with Center Circle Adult Day Services in Richmond. Heather, thanks.
Thank you. Heather Turbine-Pollard with Circle Center Adult Day Services in Richmond, Virginia. We are a nonprofit and a proud member of Leading Age. And really, I'd like to talk about the unique niche that places like Adult Day and in-home and other support services that fall outside of nursing homes, but are community-based. So these are home and community-based services. As the senator alluded to, these are electional and optional services for states then to dole out to local communities like me. It's a critical component. Our nonprofit, which is 50 years old, has been caring for largely moderate to severe dementia, those who are living with dementia and Alzheimer's, but are choosing to stay home, right? They're a community-based model that lets all of us, which is what I want and what you want probably, to age home as long as we possibly can. And so we serve 130 older adults at our facility. Medicaid is a large part of that. And currently, the reimbursement rate for the state of Virginia for Medicaid is $64.17. It is $150 a day for me to deliver that care. That is a math problem. And it's critical, and we're working with Leading Age on increasing that state reimbursement. But now, when we're faced with the chance of it getting reduced or eliminated, you can see, if you do the math along with me, how it may put home and community-based care folks like me out of business, who grew up from community, started by 5 churches in Richmond, Virginia, and have evolved into a center that's well-known and supportive services. Senator Sanders talks about the caregiver, and it's so important. I could probably ask you to raise your hand or think to yourselves as you're watching, who of us knows somebody with dementia or Alzheimer's who we've cared for, right? We all have been touched by that. And so these caregivers are burdened with that. They're also working. 60% of our caregivers work, and they need a community-based option by which to send their loved one. So Adult Day, though it's little known in the long-term care services continuum, is a social model that offers health monitoring, a very important part of a staff that's well qualified to deal with dementia-friendly practices and education. We are an extended member of that family. Community-based care models like ours are extended care for families. So a very critical part of the component at a time when some others in front of me said, we should all be turning up the dial on all the services across our continuum that can support older adults and their caregivers, caring for them as they age. It's not the time to take that away from folks. So thank you for the opportunity.